honourable member for Edmonton-Whitemud.
I really appreciate this opportunity to speak in response to the Lieutenant Governor's speech from the throne. That speech was one of the highlights of my life, being able to participate in hearing it. I am celebrating my 67th birthday today. And I can say that for about 60 years I have been interested in political life. One of my earliest recollections of my father, who was a strong supporter of another party, was his disappointment in hearing the results of the election that saw Mr. Diefenbaker assume a minority government in, I believe, 1957 or 56. I have remained eager to see the defeat of Conservatives ever since. I do want to speak to the in response to the speech from the throne because it really invigorated me. It motivated me. It is a pathway for the future of this province. We are going to see change in this province. We're going to see the public services of this province elevated to the level that we Albertans deserve. That's the promise that the speech from the throne gave us. And what I think our job as legislators in this assembly is to make sure that that vision is fulfilled. To fulfill it, we need to look carefully at the way our tax monies are spent, and I'm in complete accord with the members of the opposition in wanting to review boards and commissions and make sure that all of the management of our important public services are administered in the best way. And in my opinion, the best way is a publicly administered system that is publicly accountable and which gives the best possible service to all of us Albertans. So it is evident that I'm interested in healthcare. I have spent the last 38 years, and it's almost my anniversary of arriving in Edmonton. I chose to come to Edmonton because Edmonton and Alberta had a cancer program that was actually started through the foresight of a social credit government. Mr. W.W. Cross, after whom the Cross Cancer Institute is named, was the health minister in the Aberhart government, I believe, and he established the Alberta Cancer Board. The Alberta Cancer Board is, or was, until the previous government destroyed it, was a model in the world for a comprehensive cancer service. In that Alberta Cancer Board, I join with nurses and technicians and hospital cleaners and secretaries, as well as advanced nurse practitioners and clinical researchers, and I could go on and on. We are a team, and our team is focused on providing the best possible care for all of our patients. Any patient that shows up at the Cross Cancer Institute can count on me advocating for them if they're my patient, or that whole team advocating for them. So when I was running in the by-election and in the general election, I would say at the door that I really wanted to see healthcare in general be modeled on what the cancer program does. And I still am of that opinion, and I've been in discussion with the Minister of Health and Seniors as to how we can promote that model. Teamwork, accountability, making sure that we provide world-class service. No patient in Alberta needs to go to the Mayo Clinic to get better care. We can provide superb cancer services in this province by Albertans for Albertans. One of my great privileges has been to do a lot of clinical research over the years. And in fact, I was the site leader at the Cross Cancer Institute for clinical research for several years. I enjoyed that work because it allowed me to be able to give my patients access to medicines that they might not otherwise have access to, medicines and other treatments that they might not otherwise have access to. But it also was a way for us oncologists to tell the government, or at least the health service, what the evidence was that would support getting this particular treatment in place in this province. Now, to do clinical research, you need a big team as well. You need statisticians. You need people that can keep data, basically IT specialists. You need people that are experts in ethics, so we have to be able to consent to our patients. And those patients have to be able to understand what's going on. Sometimes we have to do it in another language so that they truly understand. We have to be very careful with that. So we have to be very conscious of things like confidentiality and privacy. And I think that's something that all of us as legislatures need to be paying attention to as well. You may have heard over the years that I actually went outside the system at times to advocate for my patients. I advocated within the last year and a half for the addition of a medicine called brentuximab, which is a monoclonal antibody treatment that is very, very effective for a form of Hodgkin lymphoma. And I had a patient who desperately needed this medication. So what I had to do was to marshal all of the evidence that I could get from the medical literature. And then I went through our tumor group in the cancer program and was able to get their support for this. Despite that, the powers that be that were in place at the time decided that we Albertans couldn't afford it. So to get further action on that, I did go to the media and made a public appeal. And that public appeal was successful. And I can tell you that that patient, as well as several other patients, have benefited from the addition of brentuximab to the list. I'm very proud of that sort of achievement. And it's the sort of thing that all healthcare workers in this province will be doing and can do if they're given the appropriate environment. So as I said, I'm a very proud Albertan. I'm here by choice. I came from the United States and made a conscious choice to come into Alberta. I'm still proud of the fact that I came to Alberta. I'm particularly proud of the fact that we had such a fantastic throne speech that is going to help all Albertans achieve the sort of satisfaction that I have. I want to turn just for a few moments to what the other members have done. And I really want to compliment the people that have given their responses in their maiden speeches. I've enjoyed every one of them. I'm humbled to stand here and speak because my experience is only one of the 87 that exists in this legislature, and I'm really looking forward to working with all the legislators in this assembly. So I was born 67 years ago actually in the hospital in Brandon. I'm a prototypical baby boom baby. In fact, the boom was on, and I have sympathy with the previous speaker's situation. The Brandon Hospital was so busy that my bassinet was a peach basket. So I spent the first few days of my life in a peach basket, apparently. I don't recall that. But, and I think that some of the pressures we're seeing on the healthcare system now really reflect what was going on in 1948 or 1950 in that era. So I spent the first 9 years of my life on a farm in southwest Manitoba. I still have an ownership interest in that farm, and when agricultural issues come up, I don't want to be excluded from their discussion just because I'm a big city representative. One of the things I learned from growing up on the farm is that the farmers are very capable and they can achieve lots of things, but they do need the government's help from time to time. They do need things like, for instance, something we had in 1948 that we don't have now, a wheat board to help us sell our wheat, which was very important on that grain farm in southwest Manitoba. We also need water regulations, and we need regulations that control pests in our animals. You cannot farm without some regulations, and I would say that we cannot live as citizens of this province without some degree of help from the government in making sure that health and safety and financial services and retirements and or pensions and hospitals and schools are run in a collective way to make sure that everything is done well. I mentioned that I grew up in southwestern Manitoba. I had the great opportunity to go to McGill University and I lived for 8 years in Montreal, and then I went to the United States to complete my training in hematology and medical oncology. I still practice, although I would hasten to mention to all members that unless you have a cancer problem, I'm not much use to you. The member from Fort McMurray, Wood Buffalo, is probably a much more capable person of dealing with medical emergencies than I am. And we have several nurses, at least in our caucus, that again would be much more capable of dealing with the colds and flus. I did help one of my colleagues with a nosebleed the other day, which I'm pleased with. And I didn't submit a bill either. I want to turn, just because we were talking about collegiality in this assembly, and there was another instance of collegiality today that I participated in that I want to bring to the attention of the whole. The member for Strathmore Brooks was expounding on all the rodeos and exhibitions in his area, and he mentioned there was going to be a running of the bulls. So immediately, I sent him a note saying I would pay, what would I have to pay to see him running the bulls? And in fact, I would pay for the Old Didsbury member to run the bulls, and maybe the Drumheller member to run the bulls. Yeah, that's right. I think some of the repetitive questioning might be diminished, but I am a proud husband, a proud father. I'm actually a grandfather now, since I'm 67. My wife Joan is a professor of oncology at the University of Alberta. She is a radiobiologist. She claims that she is the real doctor in the family since she earned her PhD, and whereas I'm a glorified tradesman. You can imagine the discussions over the dinner table. One of the things that Joan has accomplished is that she was an active member of the 35 and over soccer teams that we have a plethora of here in Edmonton. In fact, she played on the Riverbenders team. For those of you that don't know, we have more vintage, i.e. 35 plus women playing soccer in this city than any other place in the world, apparently. And you can see the kind of support that this has led to in terms of getting the world-class tournaments that we're enjoying right now. My children are both doctors. One is a surgeon, like me, a glorified tradesman, and the other is a genome scientist. They are the products of what I consider to be the best education system in the world, Edmonton Public School Board. And I say that without any reservation. Edmonton Public, and I dare say Calgary Board of Education, the Catholic equivalents, the school boards in rural Alberta produce some of the best students. When my daughter went to McGill University to follow in her father's footsteps, she was shocked to see that she was about 2 years ahead of Ontario and Quebec students at the same level. Like the member from Strathmore Brooks, who unfortunately is not here, I have a Scottish grandmother. And I actually listened to my Scottish.
Honourable Member, I must tell you, many of the points you're making were, I think, well received by all of the House, but I must tell you that your time is up. Are there any questions and answers to the Honourable Member? Honourable Government House Leader.
Thank you very much, Mr. Speaker. I'd like to ask the Honourable Member if he could finish his comments with respect to his Scottish grandmother.
Honourable Member.
Thank you. Thank you to the legislators for allowing me to do that. My grandmother and grandfather emigrated from Glasgow about 100 years ago. They came to Manitoba and worked hard, and one of their values were the values that I have of valuing education as well as hard work and commitment to the community. I am very appreciative of their influence on me, and I thank the members for the indulgence of allowing me to express that.